I want to thank you for being here. This morning I'm joined by Sheriff Richard Roundtree, our Fire Chief, EMA Director Chris James, and Georgia Department of Public Health Director Dr. Stephen Goggins. The safety and well-being of our citizens is our #1 concern and priority. It is with this in mind that we want to provide an update to our community on the steps that have been taken to ensure the health, the welfare, and the safety of all of our citizens. Individuals like you and I, through community collaborations, have the power, if we have the will, to stop the spread of the COVID-19 virus. On March the 13th, 2020, President Donald Trump declared the outbreak COVID-19 a national emergency. On March the 14th, 2020, due to the COVID-19 pandemic, Governor Brian Kemp declared a public health emergency for the entire state of Georgia. Following those directives, the CDC then issued guidance on the emerging and rapidly evolving situation related to COVID-19, including how to protect oneself from becoming sick, recommending the use of social distancing in order to prevent the continued spread of the virus globally. And on March the 16th, 2020, I declared a local public health emergency pursuant to Georgia law and Ordinance 7698 as a result of COVID-19. I also designated the Augusta-Richmond County Emergency Management Agency as the lead agency for responding to this public health emergency and for coordination of all emergency response activities and other matters pertaining to the emergency declaration. With Executive Order 2020-003, it was ordered that water, being an essential to health, safety, and welfare of all of our residents, would have a 60-day moratorium established for residential water cutoff notices while customers' bills were in dispute. That will continue to be extended until further notice. We also had a 60-day moratorium on all residential evictions, working in concert with the Marshal's Office, which will also be extended until further notice. It was during that time that we declared that all Augusta recreation facilities, community centers, and government buildings, excluding the court system, would remain closed to the public. Continuing with that, the Honorable Judge Harold Melton, Chief Justice of the Supreme Court of Georgia, issued a statewide judicial emergency in the state of Georgia on March the 14th that would continue until April the 13th unless extended by Chief Justice Melton. That order affected all courts and clerk's offices in the state as it relates to all judicial proceedings, and to the extent feasible, courts should remain open to address essential functions, and in particular, courts would remain open and give priority to matters necessary to protect health, safety, and liberty of all of our individuals. During that time, we stated that all group gatherings, rentals, programs, and activities through the Augusta Parks and Recreations Department would be suspended until further notice. The date of April 1 had been used in the past, and again, pursuant to what will be established later today, Executive Order 2020-006, those facilities, to include the Augusta libraries and senior centers, will be closed to the public until further notice. Today we're here to affirm to the citizens of Augusta not only the steps that we've already taken, but to express grave concern around the issue of safe social distancing. I know most have done a good job and will continue to do so, but I'm worried, as many of our public health officials, law enforcement, our EMA director have expressed concerns as well, that there are some who do not seem to care about the many others at risk to the COVID-19 virus. We should be able to practice safe social distancing at home when possible, and it should not have to be mandatory. But the few who are not acting as responsible as others are driving a decision that very well could require mandates greater than what we've already done at this time. Today, more than 75% of the American people are now under a city, a county, or a state mandate to stay in place. Millions of Americans have been asked to do what might have been unthinkable only a month ago. Don't go to work, don't go to school, don't leave the house at all unless you have to. These directives to keep people at home and to stop the spread of the coronavirus began in California, and they've quickly been adopted by many states across the United States. Today, more than 261 million people in at least 31 states, 82 counties, 18 cities, to include the District of Columbia and Puerto Rico, are being urged to stay at home, according to the New York Times. And for those of you who are Augustans, I recognize that sheltering in place is complicated. It affects people, it affects their families, it affects how we do business, both large and small alike, and it has the potential for impacting the economy in ways that we don't understand today. If you think you've been exposed to the coronavirus, then you should stay at home and monitor your health. Our public health officials have indicated the same, and I want to urge those of you who are watching, those of you who are paying attention to what's happening in the nation and certainly in this community, if you are sick, stay at home, call your primary care provider, and get the assistance that you need. According to the Georgia Department of Public Health, staying at home after a possible exposure called quarantine is a critical part of limiting the spread of COVID-19. If someone receives instructions to quarantine, they should remain in their residence and stay away from all public places for 14 days after their last exposure. They should only leave home to receive medical care. And I emphasize, they should only leave home in order to receive medical care. I continue to believe, and I know that our scientists and experts share the same thoughts, that voluntary social distancing can shorten this pandemic, but I also realize that some people continue to not take this serious. Even if you don't care about your own health and safety, or if you believe you're immune, please respect others by social distancing, washing your hands regularly, and staying at home when you're able to. Again, today I will be issuing Executive Order 2020-006 that extends the actions from Orders 003, 04, and 005 until further notice or amended by the Augusta Commission. This order, 2020-005, is the order that was enacted on this past Saturday that speaks to the issue of not gathering in groups larger than 10 and only essential businesses remaining open. This is the next step in an ongoing effort by city leadership to flatten the curve of the virus. As more testing is being conducted than in previous weeks, the numbers of confirmed cases will rise. As testing and reporting comes into sync, know that there is likely someone in the community who has been infected and not know it until later. Stay at home if possible. Practice social or physical distancing of 6 feet between one another, and help us save lives in Augusta. It is an expectation that we have for the community. We need your support in that, and we're going to take every measure to ensure that we're enforcing those things as we move forward in trying to ensure the health, welfare, and safety of all Augustans. At this time, Sheriff Roundtree.
Thank you, Mr. Mayor. I would like to cover the law enforcement component in response to the COVID-19 state of emergency as it relates to Augusta Richmond County. While the executive order issued by the state as well as the county gives law enforcement the authority to enforce all aspects of the orders, we would like to view this as a last resort. It is our hope that the citizens of Richmond County will make themselves aware of the restrictions and practice voluntary compliance. The following are some key points that I want to stress in reference to the state of emergency. At the Sheriff's Office and first responders, our first priority is going to be the preservation of life and the well-being of our citizens. We, since the crisis has started, have not missed a call. We are working in this building. Everyone in this building has come to work. Every deputy has come to work. We have not missed a shift. So that will continue to be our primary focus. We have modified our protocols to maximize our services to citizens while minimizing the risk to customers and deputies. We've enacted our differential response, which would normally we will come to your home and take a report if necessary of a nonviolent or just a nature of a property crime. Some of those calls are now being diverted to this building, to our records division, to free up the deputies to respond to more emergency and urgent calls. We know that sometimes this is an inconvenience, but this is necessary to, again, to maintain order, to have deputies available to respond to emergencies, and also to get you the paperwork and what you need to fulfill your daily lives. We understand that this is a very stressful time in our community, and first responders, just like the community, is also experiencing some of these anxieties. It's this stress that continues us to serve through the 24/7 hours a day of the rigorous job. So we do ask the public to be patient with us, as these deputies do have families of their own, but they're still coming out each and every day to respond to the needs of this community, and we will gladly do so. The sheriff office, along with all first responders, are dedicated to this individual task. I have directed my deputies to also practice the safe distance protocol with using caution when they may have to interact with others. As you know, in law enforcement, there's an increased risk for exposure when you're dealing with individuals who are responding to medical calls or individuals who have committed violent offenses, and arrests have to be made. We're taking all those protocols, but again, the risk is still high. We're also taking steps to maximize potential in our jail so that exposure is low to the inmates. We currently now have over 950 inmates incarcerated in the Charles B. Webster Detention Center. So that population, along with the staff who monitors them, also are at a higher risk. So we're also working with the EMA and our medical facility providers to ensure that all those individuals are as safe as possible in the environment in which we're forced to continue. The enforcement of executive orders, as the mayor stated, is a law enforcement entity that we can, in fact, enact. But we hope, again, we do not have to get to that. One of the things I want to make important, especially when we talk about social distancing, and the order exists to the fact that this is both public and private gatherings. Both public and private gatherings of individuals of 10 or more that cannot practice social distance are subject to the enforcement of law enforcement. But I can't stress enough how responding to these calls divert resources from other primary and proactive calls. To give you an example, since the beginning of this year, the Richmond County Sheriff's Office have taken over 92,800 cases of incident reports. Over 92,700 cases have been investigated in Richmond County since the beginning of the year. As of March, when we know that this virus and this state of emergency was hitting the Augusta area, in the March alone, over 7,600 cases of deputies had to individually respond to incidents in Richmond County in March. There's over 7,500 direct interactions with citizens of Richmond County since March 1st through 9 to 5 this morning. That's the increased risk in which the deputies, that does not just include other first responders, but that's just deputies alone in Richmond County. And you can see how that magnifies the risk. Now, we have to divert those resources to break up social gatherings because people feel they need to gather in parking lot or parks, and to enforce this order to make you voluntarily comply. Those resources are not in your neighborhoods. They're not up and down the shopping centers, the streets, making the highways safe. They're not doing the very best proactive measures that we can to ensure the safety of all these citizens. And that's why it's important that we do not have to divert those resources to enact these orders in a law enforcement manner. However, I do want to be clear, as the mayor has stated, many cities throughout this county, and I mean this state, have enacted measures much more stricter than we have. And as the science dictates, if that's the direction we go, we will in fact head down that road. But we hope not to if the citizens of Richmond County can abide by the rules, and let's band together and defeat this crisis together. One of the last things I do wish to cover, and is of a personal nature or a personal request, I would like to reach out to all of our faith-based communities. As you are also practicing safe distances and not gathering and congregating. And we've seen that most religious organizations have now started to stream online services or provide prayer services through their citizens through social media or live stream, and that is absolutely wonderful. But my personal request is that these faith-based communities take a moment out of each service to personally take a pause to thank and pray for the first responders, the frontline healthcare workers, and the support elements of the first responders that are going out each and every day to perform a service that is critical to the safety and survival of our community. Again, this is only a personal request for the prayers, but we are mandating the order that the congregations do not congregate in more than 10 or more per the executive order. It's important to know that the first responders, the citizens of Richmond County, and the frontline health workers know that they are appreciated. And that is why I make that personal request. Thank you, Mr. Mayor.
Good morning. As we've seen, cases have continued to increase in Richmond County and our health district and across the state of Georgia. And as the mayor mentioned, as testing continues to grow, become more easily accessible, and results reporting improves, we anticipate that case numbers will continue to increase. From a public health standpoint, we are still doing individual level interventions, that is contact tracing. We are reaching out and talking to all cases, people with a confirmed positive test. We're helping to identify folks that may have been exposed through that case, and we're giving recommendations for how they can respond. However, as the case numbers increase, the community strategies are the ones that are going to be the most effective and the most important for limiting the spread of this illness. That's why it's so encouraging to hear about all of the different changes that have been made already. But I would like to make a specific request to everyone to follow the mayor's executive order and the governor's executive order and the general public health recommendations, which would mean staying at home as much as possible. And if you have to go out, follow the social distancing 6 feet apart guideline. But there's two other groups of people that I wanted to speak to specifically. One, folks who have an exposure, they think they've been exposed, or someone has given them a directive to quarantine. For those people, they should stay at home for 14 days and not leave home except for a needed medical appointment. And during that time, they should monitor their health. If they should have fever, cough, shortness of breath, the symptoms of COVID-19, then they can contact their own healthcare provider and develop a plan for how to manage that. For people who are ill, those people should isolate themselves at home as well, and that means as little contact with others as possible, including folks in the house. And they should stay in that isolation for at least 7 days, and they should have at least 3 days of no fever without using any kind of anti-fever medicine before they break that isolation. Those strategies right now are the ones that will have the most impact on the spread of coronavirus, and so it is critically important that everyone do their part to try to protect the health of the community by following those recommendations. Thank you.
Good morning. As the Augusta Fire and EMA agency is the lead agency to enforce the mayor's executive orders, we have worked and coordinated both with the Department of Public Health and GEMA to assure that our local agencies that need resources, those resources are available. And so we have put in orders to assure that our hospitals are getting the needed equipment. We have put in requests for additional medical teams from the National Guard to come in and assist with Augusta University. We have put in for ventilators for our hospitals, as well as additional PPEs. We've also put in those same requests for some of our local agencies as well, such as our Sheriff's Office, our RCCI, our first responders across the board. We have put in requests so that those needed resources for those first responders to do their job can be done. As the mayor stated, the president has declared the state of Georgia a disaster as it relates to COVID-19, and we are tracking and keeping up with resources and what spending is taking place so that when the opportunity comes, we will be able to see to what degree we can be reimbursed for dealing with this particular incident. As far as the fire services go, we have implemented several things. We have discussed with the press. So when we're still responding and have responded to all emergency medical calls and fire calls. If it's an emergency medical call and you see one firefighter come up and he's dressed out in a gown, an N95 mask, and eye protection, we're doing that for the first responder safety. As you heard the sheriff say, the first responders are employees that have families as well, and we're taking every measure to assure that we're taking care of those first responders. We have implemented sanitation procedures for them cleaning their equipment as well as cleaning the fire stations themselves. We have instituted, as the mayor's order, shut down all public buildings. That included the fire station. If you come up to a fire station with an emergency medical incident or issue, the fire truck or the ambulance will drive outside of the station to assist you and get you help. But we're taking all measures to assure that while we take care of the public, we also take care of those first responders that are responding to you each and every day. The numbers that we see come in from the state, these numbers are numbers that the state has confirmed, but the testing agencies and the people that are doing the tests, we believe, have more positive tests than actually being reported by the state. That's a procedure that they go through before they can say this is a positive test, and then therefore some of the local testing areas, the numbers will be a lot higher. So if you hear the numbers from Augusta University, who is one of the state testing sites, as a much higher number than what is reported on the Department of Public Health's website, it's because the procedure that it goes through. The local testing will get the numbers a lot quicker than can be confirmed by the state. As the sheriff and the mayor and Dr. Goggins has already stated, please take this very serious. The measures that are being taken now are truly to try to get to that curve. It is truly to try to flatten this out. And if the public don't assist us, it's going to be very difficult, and the longer it's going to take us to overcome this COVID-19. So please follow those instructions. Help us, help you, help our community. Stay home. If your doctor says you are quarantined, then you stay at your home. If your doctor says that you are isolated because you have a positive test, then you need to stay in a room at your home, separate yourself even from your family. Have someone bring you food. If you have the ability to identify a restroom that's just for that particular person, then use only that restroom. But we implore you, please take this very serious. We're hearing other communities that are really struggling with dealing with this COVID-19. We can handle it if we work together. Thank you.
We'll take a few questions, if there are questions.
My question's for the sheriff. You said you all will enforce the mayor's order, but you're hoping it doesn't get to that point. What does the enforcement look like?
Absolutely. Worst case scenario would be the apprehension of the individuals not following the directive order. Again, we're not at that point. This is an educational standpoint right now. That's why we felt it was important for all of us to come together, let you know as a city, as a community, where we are. And we don't want to get to that point. It makes no sense to detain or isolate a person in custody based on the fact because they want to just hang out at a park or just defy order or have a cookout. It is rough for everybody. We're not doing things here, we're not doing things as a community, but we're doing it as a whole. So again, that is up into including incarceration. We're not there. This is the first step that hopefully by getting the word out, and you all get the word out and let them know how serious we are, that we won't ever get to that point.
Sure.
Yes.
Another question for you. With 950 inmates plus your staff in the prison, is there any consideration to releasing 10%, 20% of the nonviolent offenders and putting them in house arrest?
No, we haven't gotten to that point yet. In the conversation with that, I have to go through the courts. We constantly communicate with them. We're still going through some jail clearings. They're still going through the same process to make bond. So we haven't gotten to the point where overcrowding has become an issue or safety has been compromised to the point where that is the conversation of the day. What we have done, again, with our medical staff is that we are screening individuals prior to. We're taking daily screenings. We're doing anything to isolate. We've limited our visitation center. We will be revisiting that a little later to give individuals who are incarcerated some contact with their family member for support. They're still getting the same legal process. They're not denied access to their legal counsel of those nature. So it is slightly an inconvenience, but we are concerned about our jail population because we do not have the facility to totally isolate or the social distance to the nature in which we want. But again, the same thing with inmates. We have a conversation with them. The same way we're asking the public, we're asking them to do the exact same thing. Within the confines of their space to limit their social interaction. They are complying because, again, they're in a different environment, but they're still subject or subjected to the same virus. It does not discriminate on where you are. So that part of the education component that we are doing. Again, like I said, every aspect is going on, but we haven't gotten to that point yet. But we have planned for all scenarios in case we feel that that is a viable solution. We'll reevaluate at that time.
Thank you.
So, Mr. Mayor, you mentioned on the further notice the new executive order, and President Trump on Sunday said April 30 is the new, let's say, new deadline for social distancing, and they might extend it after that. Is that something that you're also looking at, April 30, or you just don't know?
No, it's a date that we certainly are giving consideration to. We're paying attention to what's happening federally, but also at the state level as well. On tomorrow at 1:30, we've got a conference call with Dr. Fauci. Mayors across the country have a conference call with the White House and Dr. Fauci, so we'll get additional guidance. But today, when we execute Executive Order 2020-006, it will be until further notice. What I don't want to do is have a date certain, and then we find ourselves at that crossroads of where, well, you said it was going to be this day. You said it was going to be this day. We don't want to do that until further notice. We'll take these measures that we've previously ordered, and we will extend them until such time that we see the flattening of the curve, a stopping of the spread of the virus, and that there's clear guidance from the state.
This might be more a question for the doctor. Are we seeing a steady increase right now from in the curve of cases, or?
Right now we are seeing an increase. Also, as Chief James mentioned, there is some lag between what's reported on the state official numbers and what we're hearing in other channels from individual facilities. And so I think that means that there's a bit of looking backwards in the numbers that we have. So I think that we are still more on the upslope of the spread of this illness.
You talked about contact tracing investigation. So you find out someone's positive, you talk to them about the places they've been or the exposure they might have created in the public, but what happens after that? Do you notify the businesses or the places they've been?
There's several possible strategies, and it depends on what kind of contacts they would be. One would be that we would get that list, and actually public health officials would call the contacts and discuss with them and give them instructions. Another strategy would be we can share information with the case, who can then pass that information on to their contacts. And then finally, if there was a situation where we couldn't identify specific individuals, we could do a general notice that says, if you were at this place at this time, you may have been exposed, and give instructions through in general to that group of people.
So Chief James, you said you made some requests about masks and protective equipment. GMA told you at all when we might see those here in Augusta?
Some have come in. It truly depends on how many resources are coming in across the state. So we do have some communities that are having a tougher time dealing with this than ours. And so as those resources come to the state, they're spread out through the state. So we have received some. We are continuing to purchase some to assure that our first responders, definitely across the board, have the needed protective equipment, as well as to assure that the hospitals are getting the equipment that they need as well. At this point, it's often not about having the funds to purchase it. It's about how getting them shipped in, can you get them in, and are they being manufactured quick enough to address our needs.
Anyone can answer this next question. Our non-essential businesses are still open, but at some of those businesses, people aren't practicing social distancing at a Kroger or Target. How is the city monitoring those places?
Well, again, on Saturday last week, we issued Executive Order 2020-005, which spoke to the issue of what businesses in particular were asked to close. Obviously, gyms, entertainment venues, salons, barbershops. We joked earlier amongst ourselves that none of us have had a haircut. And so to that end, when you have essential businesses such as grocery stores, because they are essential, again, we're talking about the health, welfare, and safety of all of our citizens. People have to go and they have to be able to shop. They have to be able to eat. They have to do those things, even when it comes to getting sanitization items, whether it's hand sanitizer, wipes. You have to be able to do those things. And so we'll continue to, again, see that order in place. As we said, we're going to extend it until further notice. We want to make sure that those businesses, as I've seen in many instances, Home Depot has already employed this. We provided measures for businesses based on square footage, what that needed to look like in that same order. We're going to continue to see the evolution of that because we do know that places like Target, places like Kroger, and again, we're just naming businesses, but independent of the names, we see the critical importance of having access to those resources, gas stations and convenience stores. The encouragement, even at our restaurants, you are able to go in and take out or drive up, and I think that people are generally complying with that. That's the thing that, as our sheriff has indicated, we see strong effort through organizations and certainly groups where they're complying with this. We don't want to be heavy-handed in what we've requested of our citizens and our business community. And so as we continue to see compliance in that area, I think our community will be the better served for it as we help stunt the growth and spread of the virus. Troy?
Mayor?
Yeah.
This is a question from George Eskel about the likelihood that the commission will be violating the rule of 10 on its next meeting. Is there any plan to try to spread that out? People outside with the monitors, some inside, to limit to 10, or what are we looking at for the meeting?
Well, again, that's still being discussed. What we are going to do is employ teleconferencing capabilities. I am fully aware that there are, at a minimum, 4 members of the Augusta Commission, not including myself, because I will also be doing the same thing, where we will be working remotely and conducting business remotely. Out of an abundance of caution, we've urged not only the remaining members of the commission to take that same approach. We have the ability to do that. It's happening all across the state of Georgia. It's happening all across the country, in fact, where local governments are conducting business through technology, whether that's through Zoom, GoToMeetings. There are a host of tools that you can use. And so it is my hope and expectation that as you've heard from our first responders, both fire, EMA, and our sheriffs, we have to take care of our citizens, but those citizens include employees of the City of Augusta. And I would urge all of the members of the Augusta Commission to give strong and key consideration to those department directors and folks who would find themselves in a meeting where they're not able to practice safe social distancing. I do know that, again, that is certainly something that can be done, but out of an abundance of caution, I'm going to lead in that effort, and we'll be conducting the meeting from a remote location.
And this may be for you and possibly for the doctor, which
Sure.
is the vaguely together question. Is it safe to open the golf course right now, doctor and mayor? Is that, and how do you plan? Will they come outside and take your money, or how are we going to work that out if it's going to be open? How are we going to work it? And doctor and mayor, is it safe to reopen that golf course?
Well, again, I think generally one of the things that we did not do is close our parks. Following the CDC guidance, which again I think is the right thing, the CDC guidance where we're able to practice, again, physical distancing of 6 feet or more, parks allow us to be able to do that. One of the challenges that we have is when you get groups larger than 10 that are congregating at things like basketball courts where you're playing a physical sport, and so we're monitoring that. We have responded to a number of calls in the city that are related to that. But we want people to be able to get outside. I think all of the science tells us that it's good to be outside. And so to the degree that we're not having, allergic reactions to pollen, the counts are just incredible right now. We're going to continue to allow folks to be at our parks. The golf course, as you see, golf courses all across the community are still open and people are playing, but out of an abundance of caution for our employees, our golf course was closed. And I think that's the right place for us to be at today.
A quick follow, the clubhouse, that will be closed and they'll be operating outside?
No,
How are we going to?
Again, our recreation and parks folks have made a decision about how they're going to handle that. It's my understanding that, again, there's access or limited access to that, and we'll continue to do that going forward.
So this is a question for the sheriff in terms of if people are gathering with 10 or more people, is there going to be fines? Is there going to be a misdemeanor charge? What's going to happen to those people who are gathering groups larger than 10?
Well, first of all, we're going to ask them to disassemble. I mean, that's one of the things that we're doing now. So we're doing it right now. Individuals who want to go out and gather in groups of 10, who are planning events of groups of 10, we want you to postpone those. So we're telling you that now. The main thing, the key that I was making the point of, when we have to go to those, is not for the sake of apprehension of necessary arrest, but the moment we have to send 2 or 3 deputies to a group of 10 or 20, like we had to do last night at one of our basketball courts, those individuals are not in the neighborhoods. They're not on the streets of Augusta. They're not proactively patrolling, trying to stop. Because criminals still do not take a pause. And by the numbers I told you in which we've answered calls, they do not take a pause. So it diverts those resources, and that's what we're trying to prevent. Again, we're not trying to come up that people say we're harassing individuals or trying to disrupt some semblance of normal life, but that's what we are doing right now, is a temporary interruption of normal activities. But there are still things that you can do. Like the mayor said, the parks are open. Walk the parks, go out and nature trails. We have the canals. We have different events to get out. I encourage people in this building, as we come to work every day, that many of my employees go take a walk around May Park every day just to get a breath of fresh air and get out the building. But they do it in groups of 2 or 3 in that nature. So we're doing those things. So again, the main point is the resources. And you taking away from that person who may be breaking into your car or patrolling your neighborhood, because I got 2 deputies at the basketball park telling people, please, you can't be here, please go home and be safe.
You mentioned the basketball courts. In many cities, they're taking the rims down citywide. New York, in fact, took 1,700 rims down. Is that something that we're considering, mayor, sheriff, fire chief, whoever might want to address that?
What I talked about with my guys is to the fact that we are monitoring it to the fact of if we have to escalate our efforts, then we will. Hopefully we think that the citizens of Richmond County, and that's why it's important for us to assemble here today, and that's why I encourage you all to ask the questions. I know you can't get it all on the news, but we are live streaming, and the mayor's office is live streaming, some of you all live, so we're able to post it so people can see and answer and hear these questions that they're being asked. So please ask the questions so we can give you the information from us. We hope we don't get that point. I talked to one of my road patrol deputies last night about blocking off the entrances to some of the parks that allow the access to the gym. That is a possibility. We want to see what it would look like if we get to that point. We're not there, but we are planning to measures to escalate if it gets to that point. But this is our hope, that by listening to this today and you all are giving this message, is the fact that we don't get to that, because we want to be safe together. Because every one of those at the park last night, when there were 30 some odd individuals, like the doctor say, each one of those went home to a household. I guarantee you not one of those individuals lives alone. So for those 30 people who were on that court together went home to a home that's occupied by 3 or 4 other people. So think about the maximum exposure if something was to occur there. And that is the point we're trying to get people to understand.
I just want to ask about housing rights really quickly. You mentioned the eviction moratorium. So if someone can't pay their bills, they're not paying their rent or whatever is happening, they cannot be evicted during this time?
Well, let's be clear. From a housing standpoint, if you are in a home, the expectation is that you're doing everything you can to meet the requirements of being in that home. That means paying the rent. What we don't have the jurisdiction or authority to do is say don't pay your bills. I think it's vitally important for everyone who's watching and paying attention to what we've said from the day we entered into Order 1 until now. That moratorium simply suspends the court proceedings as it relates to that. There will be no court proceedings as it relates to evictions during this time. Again, following the lead of our marshal's office, who again has jurisdiction in that area, they've already begun implementing that from day one. From March 16th until this very moment, that continues and will continue until further notice. It's important for us to understand that we want people to be sheltered and shelter in place voluntarily. We don't want to go to a place of where we're mandating that. That's not to suggest that if we had to take those steps, we would not do it. We would, in fact, do that if we had to. And so if folks willingly support these efforts, as I said a week ago, the success or failure of any executive order, of any law enforcement or judicial or emergency management action is predicated upon the citizens willingly supporting, being in compliance, and quite frankly, caring about the community in which you live in. To care about the community says I care about the people in that community. And what we're all advocating and imploring folks to do today, from the Department of Public Health, EMA agency, to the Sheriff's Office and to the Mayor's Office, the Augusta Commission, is we're encouraging folks to stay at home if you are capable of doing that. We have students at home, we have parents at home, and out of an abundance of caution, we want to do everything we can to flatten the curve, and we need your help in being able to do that. And that requires folks to voluntarily stay at home and to minimize all of this public gathering as we see it.
So what is being done in terms of helping the homeless here in Augusta, and maybe from some, how can they get testing, how can they be safe, and because unfortunately they don't have a home. That's the reality that a lot of them live in.
There are a number of steps that are being taken. Director James?
Some of the steps that we have taken so far, not just with the homeless, but we have put in a request to GEMA, as we've seen in some other communities, to see if some type of hotel facility could be secured so that, you know, some affected folks could isolate themselves from other groups. We have gathered some resources and submitted them to Salvation Army, some infection control kits, and some other things to keep their employees safe. This is a difficult community to figure out what to do with, because you can't just tell them to isolate at home. They don't have a home to go to. And so we have reached out to GEMA. We are working with public health, and we're still continuously working toward coming up with an answer to address that community. We have put in a request for lodging for those infected folks so that we can isolate them from the masses. Right now, that has not been approved at this time. There is a facility in Forsyth, Georgia, where they are isolating folks, and so we will be talking and working with public health, talking about transportation modes, how do we get folks there and back to assist in isolating them. We have looked at other communities such as Albany and some places where they're trying this and kind of gauge what success they're having there to determine what we'll be able to do across the state as a whole.
Final question.
Are you coordinating with Fort Gordon at all in this, or are they a separate owned entity, or?
Yes, we have talked with Fort Gordon. We have actually submitted some resource requests for Fort Gordon as well, as they had requested things from FEMA, who went to GEMA, who then came to us locally. So we have had several conversations with Fort Gordon as far as what they're doing and what our community is doing, so we can work together on that. And so, yes, we're even filling resource requests for Fort Gordon as well.
Thank you.